A brow lift means raising the eyebrows, and so it can be done at any range of age. I get younger patients in the office that they say it runs in their family, and so if you see a spectrum of photos from their parents to their grandparents, everyone will have lower eyebrows. Or it can be just from age itself, because as we get older, everyone's brows get lower. And this makes the eyes look a lot smaller and hooded, even without extra skin to the eyelids. The ideal eyebrow position in a woman means that the brow itself sits above the brow bone on the outer edge here. And in a man, the brow sits right at that brow bone. So anything lower than that means you're a candidate for a brow lift. A brow lift is generally done under anesthesia because I have to lift up the skin of the forehead in order to raise the eyebrows. It's usually a little bit too much to be able to do in the office, but in the right person, they may be able to tolerate that. I plan out where the incision goes based on that individual person. So the incision can either be right at the eyebrow, and that can be done in an older individual or someone who is bald. The incision can also be hidden in a wrinkle in the forehead, within the hairline, or back within the hair on the crown. I don't prefer the incision in the crown because I can't get quite as much lift of the eyebrows, and so sometimes they'll relax back into their regular position if the incision is too far back. If someone has a high forehead, so if you're not bald but your hair is just coming a little bit too far back, then I would make an incision right in the hairline, and that would lower the hairline and raise the eyebrows at the same time. So big difference in both areas. Recovery after a brow lift is not too bad, and that's mainly because your forehead and scalp will mostly be numb. There are two nerves that run in the forehead here and here called the supraorbital and supratrochlear nerves. They get stretched and pulled and divided in surgery, and so for several weeks to several months you may be numb. And so I'll give you special instructions of how to wash your hair and brush your hair in that interim time. They do come back, and so they're not permanently numb because I actually look at them and make sure that the nerves do not get divided in surgery. Besides the numbness, you get a little bit of swelling, a little bit of bruising around the eyes. Gravity will pull that down. So once that goes away in a day or two, mostly people don't really have a lot of pain. Any incisions that I make, you have to take care of, keep them moist so that scabs don't form on them. And so once the stitches come out at a week, you're good to go and can put sunscreen on the incisions, and most people don't know you've had surgery.